We have a very comprehensive application form on our website that dives into a lot. Um, and then once you're hit with, have you ever been diagnosed with a psychological disorder or however it's worded? We might see things, let's take bipolar disorder as an example. And if I see bipolar, for one, in my experience working in this field for the last 10 years, I think bipolar disorder is overdiagnosed. I think there's a lot, people might have just been facing a tough time in life. Maybe there was substance abuse involved and they got that bipolar diagnosis. So I try and dive into, well, how does that show up? How symptomatic are you? When was the last time you showed symptoms like that? Are you medicated for it? How's that medication working for you? Mm-hmm. So you can take a diagnosis and kind of dig into it. And if you get a good feel from the person and think that, this is actually a fairly stable person facing some depression, there haven't been any real severe manic episodes in the last little while. There was only that one they're talking about from a few years ago. Then I would feel really comfortable treating somebody like that. I've treated plenty of people who have been diagnosed bipolar disorder, especially when working in the world of substance abuse. I've seen it cure bipolar disorder. I had one gentleman, he had a family history of bipolar and he didn't put it on his application. And then when he was in the Iboga treatment, the way he described it is there were two parts of him that had never met, the manic part and the depressive part. And they were like almost running around a tree away from each other as the Ibogaine was bringing them closer and closer together. And it was terrifying for him. But then they came together in this brilliant flash of light. And I found out about this the next morning when one of our on-site therapists reached out and said, this gentleman is having an issue. I think it would be good if you come in and talk to him. So I came in and talked to him and he's like, I don't think you should. I think I have bipolar disorder. The medicine was telling me I have bipolar disorder. And then this happened and he was describing it. And what I was able to reflect back to him was, it was Mark Hayden's paper on the young woman who accidentally overdosed on LSD. She had been diagnosed with bipolar disorder. Through the overdose, it was horrific. She had a very intense night, ended up in the hospital. But once the medicine had worn off and her father showed up the next morning, she said to her father, "It's gone," referring to the bipolar disorder. And as time has played out, that has remained the truth. It did eliminate bipolar disorder. I described that story to this patient and he burst out in tears and he's like, "That's what happened. That's what happened. It's fixed." Yeah. And he's been on cloud nine ever since. It really did. It got rid of all the major depressive episodes in his life. Borderline personality disorder, that can be a tricky one because even, I think that kind of comes with the territory of being any kind of therapist. You might bump into somebody with who can very easily latch on to you. You become the everything to them. This thing that you're going to provide for them is the answer that they've always looked for. I think even through the screening process, you can bump into that. So then it's going to be up to you. Do you think it's wise to give this person a powerful psychedelic experience? Or if you do give them a psychedelic experience, what does that look like? What medicine do you use? Maybe microdosing is a good way to start. Maybe breath work is a good way to start. Put them in an altered state without a substance that they can easily hop out of. And then how does that borderline personality disorder manifest from there? So take your time. There's I used to always say with Ibogaine in particular, there's no such thing as an Ibogaine emergency. If you feel like you're in an Ibogaine emergency situation, somebody might die through giving them Ibogaine. Like, just take your time. And I think when we're looking at something like end of life anxiety or true suicidal ideation where somebody's standing on a precipice, there may be emergency type situations, but if you're feeling that, if you're acting from that, I would really advise somebody to stop, analyze the situation, get a second, a third, a fourth opinion, reach out to colleagues. I've got an incredible medical team of physicians and paramedics and nurses, all who know Ibogaine. My business partner's been working with Ibogaine for 10 years. He's a paramedic. My other business partner is he's the lead author on the clinical guidelines that everybody uses for Ibogaine assisted detoxification. Yeah. So that's really why Jose, my paramedic friend, why he got passionate about Ibogaine is he saw a lot of mortality in Ibogaine clinics in this part of the world in particular. And that's been his passion, is to really learn the ins and outs of the medicine so that doesn't happen. That includes EKGs, that includes knowing what medications people need to come off before they come. It includes looking at comorbidities and risk factors properly and getting to know the patient properly. And it's great working with this incredible team that really, there's multiple layers of screening when we're working with the nonprofit that sends these vets here as well. So we'll often get a call from a coach ahead of time saying, hey, look, I'm noticing this. This guy drinks way more than we thought. Maybe we should put him to a detox clinic first. Great. So yeah, multiple layers. The other beautiful thing about what I've got going on right now is my 3 business partners. 3 people making decisions is way better than 1 person making decisions. Any one of us has veto power on whether or not we treat somebody. So we all have different experiences. Some of us might say, oh, it might be okay. And it's happened a couple times. I think we could probably treat them. And no, my interactions with this guy make me uncomfortable. Let's not treat him. So I operated as a lone wolf for a long time. It served its purpose, but I wouldn't go back there at all. Find a cohort you can riff off of and share ideas with, because there can be some dark and stormy nights if you're all alone with somebody who's having a really rough time on medicine.